Good morning, everyone. Welcome to the webinar. I'm Jeff Beglin from Cornerstone. Here in my 20th year at Cornerstone and my 11th OEP as we get things rolled out here. And we've been doing this series for a couple of years now. And in this fall, we've probably done about 5 or 6 of these rollouts with carriers. And now on deck is Molina and my friend Kasai Tefez. Before I toss things to Kasai, just some housekeeping. You know the drill. If you got a question, you'll put it in the question box, and I will address these at various breaks throughout the presentation and at the end of the presentation. Okay, so just some more information here. There's my email. I'm the business development manager here at Cornerstone for the individual market. All things individual, all things Obamacare, all things ACA, all things associated with all the rules and regulations and markets, strategies, quoting, technology, client information, commissions, and by the same token, Carla Winfrey, our individual specialist, she's the back office for us. She's the our person in charge of helping out with customer service issues, some claims issues, diving into commissions a little bit. So reach out to her with your day-to-day needs, and she's doing a lot of outreach right now, some valuable outreach to agents in terms of looking at delinquency reports and stuff she sees out on Health Sherpa and that kind of thing. I also want to point out, if you're having any issues with Health Sherpa or any of the technology platforms, I mean, primarily Health Sherpa, reach out to me and we can get that sorted out. Okay. All right. And with that, I'm going to toss things to Kasai. Before I do that, I'm just going to see if you've got any questions, any urgent, pressing needs. And okay. Thanks, Lisa. Okay. I am going to toss things to Kasai. Kasai, if you could share your screen now.
Absolutely. Here we go. All right, let's close this.
Yeah. Okay. Yeah. And if you wouldn't mind maxing that screen out. There you go.
I am.
Okay.
How's that looking?
We're off and running. It looks great. It looks great. I'll go on mute. Take it away, Kasai.
Okay, perfect. Thanks, Jeff. As always, you guys are an amazing partner. We've done this now for quite a number of years. Definitely excited about this OEP, even though it's going to be a challenging one. I think at the end of the day, we got people to enroll and we have to take care of business, right? So thanks everyone for taking the time to join this morning. I'm going to go ahead and cover. I did initially have Illinois here. I just deleted it, so forgot to take off Illinois from the first slide here. But this will be focused mainly on Kentucky and Ohio. So we'll review our product offerings and some of the changes that will be implemented in 2026. All right, so this is just really a quick reminder. This is something that in our FFM states, our open enrollment will begin November 1st and will end January 15th. It will be the same for Ohio and Kentucky. So a little bit about Molina. As I've said in the past, Molina was founded by Dr. C. David Molina, an ER physician. It is a true Medicaid managed care, really established 45 years ago to address the needs of the underserved, covered families and children on Medicaid, to address health disparities. We are a Fortune 500 company ranking 125, but we still stay true to our foundation, even though we are a publicly exchanged company today. Here's our national footprint. I have lighted here Kentucky, Ohio, and Illinois, but we are not going to cover Illinois. And Kentucky, we're currently in 30 counties. I'll go specifically over the map of Kentucky. We will be expanding into one county, however, exiting 25 of those 30 counties, so ending up with 6 counties in that state. Mainly, we're going to be in and around the Lexington market. In Ohio, we're currently in 78, expanding into 2 new counties, bringing our total footprint to 80, and that's 80 out of the 88 counties. Here's our Kentucky service area. So as you can see, unfortunately, due to the realities of 2026 OEP, Molina decided that we will be retreating from 25 of the 30 counties that we're in, especially the Louisville market, and retreating to the Lexington market, so expanding into one additional county, Bourbon County. This is where we remain. I think this is where we're going to have the best opportunities. We have added 1 new hospital systems here as well that will help address the needs of the population in that market. Here are the hospital north. The new addition will be St. Elizabeth will be the new hospital system added to service our marketplace and members. Everything else remains the same. Here's our at a glance benefits for our Kentucky passport benefits. So every plan will include free virtual care, annual wellness exam, routine preventative screenings for children and adults, routine vision exams for and eyewears for children. Anyone under the age 18 and under will also qualify completely free of charge, built in with every plan that would be offered preventative prescription drugs, 24/7 nurses advised line. The plans offered here, the Passport Silver Core 94, 87, 73, and 70, or our CSR options. As you can see, it starts with pretty decent, very low, 0 deductible to, it goes higher as you go to the 70 core. Now, some of these plans will have the adult vision, and now, for the first time, Molina will be offering embedded dental options also with certain plans. The Passport Silver Saver 94, these are what we called last year, we have been renaming them the Silver 12 with 4 free primary care visits per year. And we're going to have a variation of these options, some including dental, vision, and dental or vision, or both, with some of these options. Highlighted in the bottom are services where deductibles will be waived. Members can access these benefits strictly based on copay. Continuation of this, inpatient services, outpatient, professional office visit. You can see across every plan that members are able to access or take advantage of these benefits strictly based on copay. And which some of these copays obviously vary, but pretty decent benefit for our members. And for outpatient hospital facilities, similarly, you'll see in the bluish color, our services where we will waive deductibles for these services. There we go. And when it comes to prescription drugs, obviously preventative drugs will be completely free of charge across all plans. Preferred generics will be accessed without deductible based on copay. Preferred brand with certain plans that will be available based on copay with deductibles waived as well. And there you have it. We will also be offering the Passport Gold 1640. That 1640 identifies the deductible in that plan. These are very rich, low deductible options. I think in some cases you'll find these more attractive and maybe even better priced in certain markets compared to our silver option, especially for individuals who may not be, getting subsidies. So definitely a great option. Also similar to the bronze and silver, these will also be, services where we waive deductibles of these benefits. All right. Ohio, here's our service area. We will continue to be in existing counties plus expanding into Harding and Carroll County. Our goal ultimately is to be in the entire state. Ohio has been a great state for Molina Marketplace. We have grown upwards of 120,000 members overall today and looking to grow. And I think it's going to be a great year for Molina and Ohio. Ultimately, as we secure adequate network in some of these counties that we're not in, the 8 remaining counties, we expect to be in all of them, hopefully by 2027, 2028. Just to give you an overview of some of the hospital systems, nothing has changed. Having said that, I am expecting an update of any network changes for my provider contracting department. But as far as such today, it is going to remain identical to what we had in 2025. We'll be sure to send this out to you through Jeff, through Cornerstone, and you guys will have a copy of this. Now, you want a unique thing, just worth mentioning that Molina's ACA network is available to all Molina members, regardless where they live. So you could live in Columbus and have access to the Cincinnati hospital systems. Also, to make it convenient for our members who live on the bordering counties, we do have hospitals in West Virginia and in Kentucky, as listed here, that would be accessible for our ACA members. Okay. So this is a state-by-state portfolio changes, and especially in Ohio. So we will offer several new plans, including silver, bronze, and gold. Some off-exchange plans as well, and on exchange, including the dental options. We are renewing all of the new options, all the new existing plans that we have. However, as you can see, they have been renamed. So I'm going to skip over this slide because we have individualized, detailed on these that we're going to cover. And by resources, we will continue to offer our members the $200 wellness incentive for members who take care, make sure they do their wellness assessment, and make sure that they visit their primary care physicians for their annual wellness exam. Now, these are available to anyone 18 and over, and they will receive the gift cards in increments of $50 as they complete different health assessments and PCP well visit. So great program, and it also really provides a suite of tools and programs on topics such as smoking cessation, diabetes management, managing depression, and healthy living videos, libraries, and exercise, diet, and nutrition will also be available for members to access through their mobile app. The RX Savings Solutions will be continuing as well. This is really intended to help maximize members' prescription benefits and lower their out-of-pocket max. Information on this will be sent out with their welcome packet as they enroll, and they may also access this through their mobile app and may call the 800 number listed here to learn more about this program. Our utilization of the Molina mobile app has continued to increase year over year. Certainly, we can use your help to get your clients to register for this. Really makes life easy for us, for you, for the member. They will have direct access to their information and tons of resources available to them, including downloading a digital member ID card, finding a doctor, requesting member ID card. Their member handbook as well is accessible through this. So certainly asking for your help to help us push this. It's an easy, a couple minute process to register and have access to this. Molina has unique member services number by state. So let's make sure we give your clients the correct member services number corresponding to their state. Payment options. We have quite a range of payment options available for our members, but obviously the recommended and suggested form of payment to avoid lapsing in payment and losing membership coverage is to sign up for auto pay and recurring payments at the point of enrollments. Members can certainly enroll through bill payments online directly from their bank. They may call our 800 number specific to their state and enroll and make payments over the phone, by mail, by sending a check to the listed PO box here. But they would have to allow 10 to 15 days for processing. Also, they may walk into any local MoneyGram locations to make payments in person. There needs to be a 3-day allowance for the payments to post. Last year, we also introduced check free pay. There are upwards of 30,000 sites throughout the country that members may walk into any of these locations to make payments in person using their invoice that may have been sent to them. Another one is making a one-time payment option through Bill Metrics. And if you send them the link here, we'll give them access to the Bill Metrics and they can make payments directly from there. Google and Apple Pay is additional form of payment. So really no excuses. We make it convenient for members to have all forms of payment options for them. This is great news and definitely welcome payment integration. Now you as a broker have access to ability to make payments directly from your broker portal for your clients and also set up auto pay. This could happen right after completing an enrollment. Say, give it 24 hours until we get the 834 file and the member is showing up in our system. But you could do this right now. This went live last week. So you could do it right now for your existing clients. You also could do it going forward with the new members that you have. And trainings and additional communication is going to be sent out to get you training on this and broker portal in the next few weeks here. Enrollment and premium bill payments. Molina has unique numbers specific to state, so it's very important that we give your clients the correct number corresponding to their state. Here we go. This is also an exciting change. I think it makes these plans identifiable at a glance, just from its name. So we tried last year kicking off a new plan called Silver 12, right? With 4 free primary care visits. That's what we call it. So this at a glance, it tells you what it is. It tells the member that it gives them 4 free primary care visits. So following this suit, we are going to be renaming our plans going forward in 2026. So each plan will contain the name Molina, Molina Marketplace, a second tier level identification such as bronze, silver, gold, or platinum, a core sub brand name, value, saver, essential, plus, and feature benefit descriptors such as RX copay, vision services, free primary care visit, such as the Silver 12. And these are defined here for you. So value, meaning affordability, and cheap and basic, right? Saver, low cost for the budget conscious individual. So an example would be Molina Marketplace Silver Saver with 4 free primary care visit. That would be one of the plans. That will be the old Molina Silver 12. Here are some of the new options, some of the plans that we'll be offering. All of the plans actually we'll be offering across the different markets. So if you look at Ohio, we're going to have quite a number of gold options, including some that are new, several that are new, silver options, and bronze. One thing that I am very excited about to tell you is also in the past, we excluded Franklin County, the Columbus market from having the bronze option. That is no longer the case. So we will have bronze options available across all counties in the state of Ohio.
And
Highlighted in the...
Can I jump in real quick?
Yeah.
Isn't it true that all bronze plans will be HSA eligible now per the government regulations?
This is what I hear, but we have identified 2 specific plans that are HSA for Molina.
I gotcha.
I'm not sure if every single bronze options that we're going to offer, because most of them will be off exchange. So the ones that we've highlighted here with dental and vision are going to be exclusively off exchange, highlighted in the pinkish color here. These ones, right? These
Okay.
are exclusive to off exchange. Now we are going to be introducing a heart health specific plan in Ohio only. So I'll go over that specifically. But here are the bronze options and their design. So the bronze saver 7,000. That number identifies what the deductible is on that plan. This is a budget friendly option for members, and it's defined here for you. We will have two new bronze options, one on and one off exchange. So the
Okay.
bronze standard, which is our all CMS standard option, and then the bronze Empower, which is only available off exchange. Very
Yeah,
rich
that
benefit with
answered
the
Amy's question. Yeah, great.
yeah, yeah. So each of these numbers showing right after the name is really identifying the deductible on each of these plans. Similar design with the silver options. Again, the majority of these new options are off exchange only, with the exception of the Silver Smart Heart Health, which is specific to Ohio, that will be on exchange. Similar concept here with the naming change as well as the benefits. So we'll have four new options, one exclusively off exchange as far as gold, and the three on exchange options. These will also have adult dental and vision options embedded. All right, so the Heart Smart plan that we will be introducing in 2026, this is really a high benefit strategy focused on improving outcome for members with heart condition. So this is really going to give members gold, silver, and bronze will be available, a low deductible. Cardiac specialists can be seen specifically low cost copay only with deductibles waived. Cardiac rehab at $25 and $35 of copay. Cardiac generic medications at zero copay, and cardiac brand medication at 15 and 20. And on quite a number of these benefits, when I send you the benefits at a glance, you'll see that we will waive deductibles. One other great thing about this plan is that it will offer every member free blood pressure cuff. So this is certainly a great plan for those with individuals with heart conditions, with chronic conditions. This will be an amazing benefit for them. So as mentioned earlier, Molina does have value add benefits, which includes the 24/7 telehealth virtual care. With all plans, this is unlimited and it's available 24/7. Now, it does include mental health services as well. That was added last year. No cost preventative prescription drugs, preventative screenings for children and adults, pediatric vision with all plans at no additional cost. This is serviced by VSP. It gives our pediatric members $150 in allowance. Reiterating here, the telehealth virtual care, including contact information for the telehealth virtual care, will be sent out to members. Again, key thing here is unlimited. It does now include mental health services as part of the telehealth virtual care. The adult vision option for additional premium is also available and embedded with certain plans that members can choose. Similar to the pediatric, this will be serviced by VSP, allowing our members $150 in allowance, comprehensive annual exam, routine retinal screenings, and they may get prescription glasses, frames, contact lenses up to that amount, and which they should be able to find with our vendors glasses and frames that would be within that price range. But however, if they choose something more expensive, they can pay the difference. All right, here we are. So this says Kentucky here, but it is available in Ohio and in Kentucky. The dental services will be provided, administrated by Delta Dental. And this will also give access our members their strong national network of dental providers, the diagnostic and preventative, once every 6 months, completely free of charge, basic dental services at 50% coinsurance. The max but annual benefits is going to be $1,000. Major dental services available after 6 consecutive months of enrollment. So there is a 6 month waiting period, unless the member can prove that they had prior coverage, which will be waived for them. That waiting period could be waived for them if that's the case. Here are the off exchange options. So in Ohio, all of the options will be available: bronze, several silver options, and the gold. These were really created with the ECRA population in mind. So these are very rich and really ideal for members with higher income. And several of these will be HSA compatible, or they're an HSA plan specifically. So the HSA options available in Ohio would be the Molina Empower Silver 4000, which is an HSA, and then the Molina, what was it? There are two of them. Blanking out on this one. So that's definitely an off-exchange HSA, but I thought there was a second one. Maybe I'm mistaken.
Can I jump in a second?
Yeah, go ahead.
Yeah, so Jackie asks, how do you apply off exchange? Is it through Health Sherpa?
Yeah, it's through Health Sherpa. I have a slide to
Okay.
go over that. I'll go over that.
Excellent. Okay. And just to finish her question, and maybe you'll get to this later, do you have Lake Health, or is that University Hospital, or is it just TriPoint?
It's right now, Lake Health is out, and it was out last year, if you remember. So that's unfortunately out. I know there is a discussion going on with our contracting department, and that's what I said, that I'm waiting for, update on what's going on. Hopefully, we'll have them back, but I'm not 100% certain. So I'll keep you guys posted on that.
Okay, great.
Okay, so again, inpatient services here. A lot of people ask what IP is. That's inpatient. Here are services, max out of pocket, deductibles on these, fairly low on generic medications, completely accessible based on copay with deductibles waived, even where deductibles exist. So these are really, really attractive, rich benefit plans. I think there would be good options for the ECRA and population. Here's to answer your questions. Health Sherpa will give you access to both on and off exchange. If you are enrolling someone that may be eligible for ECRA, let's make sure that you add their ECRA and cafeteria amounts so that their premium is reflected in that. Health Sherpa is going to take you then to an off exchange plan and will direct you to complete that application off exchange.
Is this available today?
No. It will be available come November 1st.
I gotcha. Okay.
Yeah. All right, so finding a provider. So this is nothing new. Just wanted to mention that Molina has 3 lines of business: Medicaid, Medicare, and ACA. Let's make sure we're searching the marketplace network versus the other ones. They're completely different. It's easy to make a mistake and think that provider is a network. So let's make sure we're searching the marketplace site. The QR code here will take you directly to the site. All right, so we've created several pieces that were created with our brokers in mind. These are brochures and flyers, benefits at a glance that could be customized to add your contact information. You may also order these through the Molina marketing store. 25 at a time. You can order as many as you want, times as you want, but they will send you 50 at a time, completely free of charge to you. So this is the brochure, the flyer. Here are the brochures and the benefits at a glance. Again, these are customizable, and you can add your contact information. You may use them. You download a digital copy. You may use them to advertise online, on social media, and distribute in your market as well. MolinaMarketplace.com is a one-stop hub for everything Molina Marketplace. So you are able to toggle between 2025 and 2026 plans. You will have access to the summary of benefits, evidence of coverage, formulary benefits at a glance. So it's a really great site that will give you resources, and this will also direct you directly to your broker portal. Just wanted to mention our pharmacy vendor is CVS Caremark. Members are able to order 90-day supply at 2.5 times the copay, so they save a little bit of money there. And so again, utilize this resources. The website will give you everything you need for Molina Marketplace. Broker resources. I think we have one of the best broker services in the industry. They're located in Salt Lake City, Utah. Open Monday to Friday from 6 a.m. to 6 p.m. That's Mountain Standard Time. Our broker portals is Evolve NXT. This link will take you directly there, and here's the email for our broker services. The QR code here will take you to broker portal, and this one will take you to the Molina marketing store where you can order different supplies that you may need.
Both of these resources are great. Broker support is great, and
Yep.
so is the NXT, which is a
Correct.
vast improvement. Love it.
Well, now that you're able to make payments for your clients is also an amazing option, and definitely welcome. So OEP readiness. Certainly you want to make sure you attend these trainings, complete all required CMS state-based certification and FFM certification. Definitely encourage you to log into your Molina broker portal by navigating to my credential, selecting my state, sales state. It's going to list every state that you're appointed in, whether you are RTS or not. If you're not, make sure you complete whatever is required for you to become RTS, ready to sell. Otherwise, you won't get paid. So let's make sure you do that prior to submitting any policies to Molina. It's Evolve. Again, your username is always going to be your whatever email address that we have for you on record. If you are new, go ahead and use that and create a new password and have access to this. If you're returning agent, if you're no longer have access, you can reset this by saying forgot password. If you completely get locked out and not able to access the broker portal, please reach out to our broker services. They will help you reset your password. You are able to retrieve your book of business. When getting to this page, all you need to do without messing with any of these fields, search. It's going to retrieve your entire historic book of business, both termed and active clients. You are able to sort it by effective date, pay through date, net due amount, pending termination, and download it to an Excel form so you can sort it any way you want. So you have all that access. You also have now access to assisting your clients with ordering member ID card and helping them change primary care physicians directly from your primary broker portal. Now, you are not able to print at this time a member ID card, but you can give them their member ID number. You write it down, give it to them, and order it for them. Molina's member ID card do not contain a primary care physician, even though we do assign them to a PCP. The only way they will know that they have been assigned to a given PCP is if they log into their digital card. Otherwise they won't know. So if they happen to go to a non-assigned primary care physician, as long as that PCP is a network, no harm done. They can keep the same card, and they won't even have to call us to tell us to switch their primary care physician. Based on claims history, if we see a member is going to a different PCP than the one assigned, on the back end, we will make that adjustment for them. Certainly, they may log in and change that themselves, or they may call our member services asking to change their primary care physician and continue to use the same card. Prohibited practices. I'm not going to read every single one of these for you, but overall, let's please make sure that we're compliant, that we are not discriminating anyone, and we're not forging any information, whether it's plans, Molinas, or CMS, or Department of Insurance. You will have a copy of this. You may review this in your own time. Thank you again for your time this morning. My contact information is here for you, and each of these QR codes will take you to different locations here, including Molina Store, Provider Network, Evolve, and the Molina Marketplace website. Thank you,
Super.
everyone. Thank you, Jeff, for the opportunity.
Yeah, and we've got some time for some questions.
Sure.
Thank you, everybody. I had a question. Getting back to you mentioned that brokers can make payments. Is that right?
Yes, that went
Um,
live last week.
mhm.
So you can log into your broker portal, retrieve your book of business, and you can see clients that have not made their payments. You can reach out to them directly and make payment on their behalf directly from your broker's portal. You can also set up recurring payments if that member or that client authorized you to do so.
Great. Now, what about the initial binder payment for 2026 on a new plan?
The initial binder payment, obviously, if you're using Health Sherpa, it's going to route you to our payment system. You can set up payments at that point as well, for sure.
But I think a lot of agents have been driving the clients to make the payment directly through Molina.
Yeah.
Just so you're directly dealing with Molina. Would the agent be able to go on to the Molina site and make that initial binder payment for the client?
Yes. So,
Okay.
you know how we send you every year, we're going to send you weekly, monthly, actually weekly and daily sometimes, um, binder payment report, right? And that's just showing you clients that are at risk, and you guys go ahead and share those with your agents. And I think it gives an opportunity for the broker to reach out directly to that member, and they have access now another form of payment from their broker portal. They can set up the auto pay and or even take one-time payment from directly from the Evolve.
Perfect. Okay. Great. We got some more questions.
Sure.
So with the issue with Sherpa, and for off exchange, if you're not using Health Sherpa, is there another portal that would allow for off exchange?
Unfortunately for Molina, only through Sherpa. These are accessible only through Health Sherpa.
So off exchange only through Sherpa.
Yeah.
You cannot write off exchange through healthcare.gov. That's
Yeah.
That's for on exchange. But
That is correct.
I'm not aware of I don't know what the cloud does or whatever. They're not one of our go-to resources.
Sure.
But if you've got a question about how Sherpa, I'll walk you through it. And you can use Sherpa just for what you want. You can use it just for off exchange if you want.
That's right. Yeah.
For the Heart Health Plan, does the PCP have to sign a paper, or does it allow for them to just join?
They can join. There's no restriction on joining them.
Okay.
I mean, obviously, if they see that as a good fit for them, I think it would be more beneficial for someone that has, some sort of a heart or a cardiac condition.
Okay.
It will benefit the most.
Okay. I'm gonna identify the elephant in the room. Clearly, nothing's been released about commissions and bonuses, and Kasai told me that they're working on that. That is, forthcoming. Pretty much true for everybody else. So we'll have more details on that as OEP approaches here in about 2 weeks.
We should have commission information released. Hopefully, it was supposed to be released today, but with so many changes with enhanced subsidies going away and reconsideration of so many factors here, they decided to postpone until next week. But I can tell you, we will be paying commission. We will be paying commission. I can also confidently tell you that we will be giving you bonus incentive for renewals. We have upwards of 100,000 members in the state. We certainly are wanting to, keep all of these members. We know all of these members, so we're going to be incentivizing you for retention. So yes, whatever rumors you hear, Molina will be paying commission in Ohio. Okay.
Do you want to make any comments about, what we're going through right now in terms of enhanced subsidies? I think it's, front and center in the news today.
Yeah.
And if you want to make any comments about that.
I guess the comment that I would make is so Molina is a really true Medicaid managed care with its foundation being really assisting low income individuals, families, and children, mainly in the Medicaid arena and the duals in the Medicare arena. And our entire purpose when entering the ACA was not a true commercial plan. It was really to address the needs of those that are highly subsidized, 250% of the FPL and below, right? So everything we do is geared to that. With enhanced subsidies going away, there's so many risk factors involved. Adverse selection. For instance, we pulled out of Michigan this year. Well, what happened? Molina was very, very attractively positioned in all of Michigan's market that we were in. Priority goes up upwards of 19.5% in 2025. They go up another 20%. We go up another 18, 19% this year, but we still are the lowest in that state. And we're going to assume so much risk. It didn't make sense since we were not allowed to refile our rates. We had no choice but to retrieve from that market, and that's what we've done. Again, it's a very sensitive market. We want to be around for a long time to serve our target demographic. But sometimes when assuming so much risk, it could put you out of business, and that's not something we want to happen.
Right. So stay tuned.
Stay tuned is true.
It's true. And we'll keep you posted on everything going forward here as well at Cornerstone. So check out our website for all the updates and info we've got on OEP 2026. I really appreciate you joining us, Kasai. Obviously, a very busy day for everybody with AEP kicking off today. But, everybody will get a copy of this presentation once more. You'll be able to go out to our website and view it at your leisure on the resource tab in our website.
And I'll send this out to you right away. I'll send you our national, just in case we have individuals who may be selling. I'll send you the entire national.
Oh, yeah, Florida. So everybody's got somebody in Florida. So,
so I'll send that out to you.
Yeah, fantastic. So any final thoughts? So, Kasai, we appreciate you being on. Are you still there, Kasai?
I'm here.
Okay. Yeah. So I think with that, we'll conclude the presentation, everybody. And have a great day.
Thanks, Jeff. Thanks, everyone. Bye.
You bet.